So you may know a couple or two that after having a child, they could not get another one. Sometimes a child, sometimes two kids. This is called secondary infertility, and it is the inability to conceive or carry a pregnancy to term after previously having a child. Now, this condition comes with a lot of judgment. Some people think you're being ungrateful for wanting more kids. Some people just think you're not being grateful for trying to have more kids. You're not grateful. At least you have one. At least you have two. I don't know why people think they can micromanage people's lives. So this is a real thing. Secondary infertility is really downplayed. People talk about primary infertility. That's when you haven't even had a child. But secondary infertility is mostly downplayed. So I came to talk to you about it today. So in this video, I am going to be telling you about the symptoms you should look out for, the factors that significantly influence secondary infertility, factors that you've not really thought about. The last one I'm going to be telling you in this video is something you should take very seriously, especially if you belong in the category of people that actually conceive but do not carry to term. You should take this video. If you're busy right now, you should save this video so you can see it later. So this last thing I'm going to tell you is for people that actually conceive but do not carry to term. You should really look into the last option in this video. I'm also going to be telling you coping mechanisms and a lot of things in this video, so you want to watch to the end. So my YouTube studio says 90% of people that watch me are not even subscribed. So I want you to take the liberty of time, if you're seeing my video for the first time, to subscribe, like, and share this video. You can share it to your friends on WhatsApp, on Facebook. Just share this video. You can leave a comment. What do you think about this video? You can talk about anything, the lighting, just anything, or leave a comment. So let's get into the video. Like I said, secondary infertility is the inability to conceive or carry a pregnancy to term after having a child previously. You've had one kid already. So there are different factors that significantly influence secondary infertility. The first of such is age. So fertility in women tends to decline with age, especially over 35 years. The second is changes in weight. Weight changes. A significant weight gain or weight loss can significantly impact your ability to conceive. Yes. There are other things like medical conditions, PCOS, that's polycystic ovarian syndrome. This can significantly hamper your ability to conceive. We also have endometriosis. We have uterine myomas, that's fibroid. Past surgeries, previous surgeries can significantly influence secondary infertility. We are talking about cesarean sections, tubal ligations, and others. And then we also have lifestyle factors. Lifestyle factors: excessive alcohol consumption, if you smoke, if you do not exercise regularly, it's kind of intertwined. Physical inactivity such that maybe it leads to excessive weight gain. Yes, it can significantly impact your ability to conceive. And this last one is very important. Like I said, it is important for people that actually conceive but do not carry to term. There's people that you conceive, the next thing miscarriages and all of that. So this particular, this last factor, people really do not list it, but it is very important, and somehow I'm sure it was mentioned to you, especially if you're married. At the beginning, when you were trying to get married, it was mentioned to you, oh, you're supposed to do, maybe by your church, because some churches actually do. They'll tell you you're supposed to get this test or that test, but you just downplay this particular test. So the reason you may be having miscarriages, you do not carry your pregnancies to term, may be as a result of rhesus factor incompatibility. Now, some people ignore this, and you may not really see the effects in the first pregnancy. It really happens from the second pregnancy. Then you keep seeing miscarriages upon miscarriages. So this is what happens. If a rhesus negative woman carries a rhesus positive fetus, her immune system actually reacts to the positive rhesus factor. Yeah. Now, the rhesus factor is protein carried by the red blood cells. So it reacts to it, and because of this, it produces antibodies. Now, these antibodies actually cross through the placenta to attack this baby who is seen as an unwanted foreign objects. I don't know if that makes sense. So it attacks this baby. It puts it at risk of a miscarriage. This, when these antibodies cross through the placenta, it leads to a disease in the newborn called hemolytic disease of the newborn. There is a medication that is actually administered to prevent this from happening. This is another reminder to take your antenatal very seriously. So if you're experiencing this, you should actually go to the hospital. You'd be administered, you'd be given Rogam. This actually helps with this particular factor. So if you're given Rogam, the mother's immune system does not produce antibodies to fight the fetus. So there are different symptoms that are pointers to secondary infertility. The first and the common one is inability to conceive. If you've been trying for a year or two and you've not had any success at all, you are experiencing secondary infertility. The second is painful or irregular periods. Painful, change in cycle, heaviness, all these are pointers to secondary infertility. And then we also have hormonal changes like thyroid or insulin resistance. All of these are pointers to secondary infertility. So there are different things that you can do to help yourself if you are suffering secondary infertility, or if you think you're suffering, like I said, you've been trying a year or two. So if you think you are suffering secondary infertility, the first and the most sensible thing to do is to go to a hospital and get fertility tests. This can range from blood work, ultrasound, and some other tests that generally evaluate fertility. Results of these tests can actually make you a good candidate of hormone therapy if that's where your problem is coming from. Maybe you need hormone therapy to regulate your hormones. But these investigations will lead to the next step. If you're having hormonal issues, you'll be treated for that. You'd also have options like surgery. That's to address any medical conditions. Maybe you have blocked tubes. Maybe you have fibroids. You can actually take them out. If you want to explore the option of having assisted reproductive technology, maybe like IVF, or even consider adoption. But the first step is going to the hospital, getting diagnosed. If your situation is critical or treatable at the time, you will get the help that you need. So the first step is getting diagnosed, going to the hospital, trying to find out what the problem is, addressing the root cause. So there are different ways to actually cope with secondary infertility. You should get emotional support from family. There are even support groups on social media now. Yes, you'd find them on certain social media. You can find that on Facebook. Yeah, at least I know about Facebook. Yeah. So you really need all the support you can get from your family, from your friends. Any support you can get is really appreciated. You can also get counseling with your partner. Yes, like I said, you need a lot of emotional support. Don't let your feelings be downplayed. You should also make lifestyle adjustments. Like I said, lifestyle factors can directly influence your chances at conceiving. If you take alcohol, you cut it out. If you're physically inactive, you try to do more. If you've significantly gained or lost weight, you fix that. And then try to see a fertility specialist. I mean, your GP is good, but try to see a fertility specialist for better suited, tailored options for you. I am sending you love and light at this trying period, and I hope all your dreams come true. So like this video, subscribe, leave a comment. What do you think? Are you going through this? Do you know anyone with this condition? Send to your friends on WhatsApp, on Facebook. Thank you for coming to my little TED Talk. I'll see you in my next video. Bye.